I am 72-year-old female, diagnosed in '09 with one blood clot in lung. Prescribed warfarin. Took for 1.5 years, stopped on my own. 2014, diagnosed with 2 blood clots in second lung. Again, put on warfarin. December 2016, came down with valley fever, given antibiotic that had adverse reaction with warfarin. Ooh. See, that's some of the problems. INR reading was 13. Hospitalized for 2 weeks. See, drug interactions. Scary stuff. You never see herbal interactions, really. I've never seen them. You know? I mean, you might have an herb that's ineffective or vibrationally against you at that moment, and it can make you weaker. But I've never seen it really send you to the hospital unless you have an anaphylactic shock to a particular herb that's in it. But that's rare. Okay, so what's interesting here, if you ever looked at live blood cell analysis and things like this, and you get into that level of thinking, any shift in the pH of blood runs the risk of changing how blood cells perform. Your red blood cells should be individual like every other cell in your body and should stand alone in the blood. When they start attaching each other or following each other like choo-choo trains, which you see a lot of that, then what's happening here? 2 things are happening here. You're eating cooked foods that are enzymatically poor and are gone, and 2, you're eating acid-ash foods, and that acid is getting into the blood, even though the blood is stealing calcium out of its basement layer of connective tissue. It's still creating a shift in pH, and any shift in pH. This is why you have a lymphatic system. And the scary thing is, you wonder when you get interstitially constipated, so to speak, in the gut wall. And say most of the absorption of nutrients is in the small GI tract, the small colon, or the small bowel. And the small intestine is about 22 feet long. So most of the absorption of nutrients, except for maybe some micro trace elements which might be absorbed in the first part of the colon, but for the most part, even your trace elements down in the lower part, jejunum and stuff, a lot of this absorption is done primarily, again, in the small intestines. A lot of people see colitis and all the colon problems, but what you don't realize is that what's going on with the colon is also going on with the small bowel. Your wall of the GI tract, that includes the small and large intestines, are all cells with interstitial spaces. Everywhere you look is cells with interstitial spaces. So when you see the interstitial spaces, again, what's in those spaces around all the cells? Blood and lymph. It's physiology. Physiology and anatomy. That's it. We're talking right on just what it is. Understanding that the kidneys and the skin, we have to look at elimination. Medical doctors don't think of elimination. But elimination is key in terms of metabolitic acids. So when that's not happening, we all know that the lymphatic system starts backing up and becoming agglomerated. Well, agglomeration means getting hard, sticking, that sort of thing, losing its fluidity. And since the lymph system is more like the tortoise as opposed to the hare, then that even compounds the problem. Well, the interstitial spaces around the cells in the small and large colon get backed up, and that's where you get what's called malabsorption. You can see it in your iridology as a thick ring, what they call the autonomic nerve ring, which is bullcrap. That is your colon design, and that ring, however thick it is or non-thick, determines how malabsorbed you are. And then you can relate that to the malabsorption ring around the pupil. It all relates, everything relates. And so the absorption of that, the interesting thing is, what are we absorbing into the blood then? And changing the viscosity and pHs of the blood in that manner as well. And then if you're a smoker, of course, that just compounds the problem, because now you're bringing in acids. And of course, this can also go to play if you're living in a highly acidic environment where the air is highly acidic. What you breathe is going to go right into the bloodstream without the effect of the liver. And so you don't have a way of changing that chemistry or altering some of that chemistry. And that's problematic to the pH of the blood. Therefore, you start to see the agglomeration taking place. At a minor level, red blood cells start clotting. And who knows about the effect interstitially when the lymphatic system becomes so agglomerated, so backed up. How does that affect that 20% or so blood interstitially? And how does that help to clot in those areas? See, because blood and lymph share interstitial spaces. And just as the lymph fluid is the dominant, the master of interstitial spaces. You know, when you have 75 to 80% of that fluid interstitially lymph, that only leaves 25% blood. So when that becomes highly swollen and agglomerated lymphatically, we're talking about acidosis, not alkalosis. Where would that ever come to play? Body doesn't create alkalis predominantly, it's acids predominantly. That's a fact. So when you see that happening, the blowback on the blood could be obvious there as well. So when you're dealing in blood clots, the first thing you want to do is you don't want to go to vegetables. You don't want to go to greens. You want to go to fruit. That's vital. You want to go to fruit immediately. Whenever you have a blood problem, you want to go to fruit and berries and melons. That's essential. High flavonoids, all of this thing, high alkalinity, high electrical. This is exactly where you want to go. Astringents, high enzymatic foods. Raw. It's like Juno or whoever this guy is you cook your grape juice and then put a little lemon to revitalize it? What? That's stupid thinking. You don't process anything like that. It's ridiculous. So you want a high grape diet, high fruit diet, whatever. Especially the watery fruits. Definitely the watery fruits. And start, breaking up that blood, getting that blood pH back to normal. That's the beauty of fruits. It has a perfect residual effect of creating blood at 7.457, 7.4, probably a little higher, which is probably a little better in terms. That's why we're down on Keegan Waters when they're trying to put 9 in the blood. Now you're creating alkalosis. Trying to bring the blood pH way up, but you can't alter the blood pH. It's already been proven. Too low, acidosis, too high, alkalosis. Obviously, there's a certain pH, and you can't get beyond that. But interstitially, the blowback, possible. So there's 2 factors you have to look at. I would be on circulation formulas, herbal circulation formulas for dang sure. I would also be looking at cleaning up the lungs of all the mucus and build up in there. So I'd be on some 3-lung tea or some lung formulas to break up sputum. But where else am I going to go? I'm going to try to get into those interstitial spaces. Well, my only route is whatever the blood can bring into those remote areas. Whatever goodies that you're putting in the blood can get those to those remote areas, which is why the importance of fruits and berries and melons. But also, I'm going to start opening up the eliminative organs of this gigantic lymphatic system. And this is for every single thing that you can write into me. This is for every single thing you can write into me. The only difference is that I'm real cautious about messing with the blood where there's tumors, because tumors are interstitial. When you watch Dr. Pimple Popper, toe guy, I have to tell you, I think the toe bro's worse. It is the grossest in my opinion. I think Dr. Pimple Popper has it better than toe bro. But when you see she squeeze and ooze that up, remember those with fighting tumors, that's what your body has to get rid of internally. And some of them are large and full of that nasty stuff. That's why a good surgeon is going to be like Dr. Pimple Popper, going internally and opening up these tumors and suctioning them out, remove the sac if you can, and then sew the person back up. You wouldn't even have to remove the tissue. Let us finish all that up. But no, can't be that nice and simple. They can't be that level of awareness. So they have to try to fry the tumor to get to a cancer cell to already deal with. The stupidity is phenomenal. So you've got to always go after the kidneys and adrenals. Remember, the adrenals are always, you got adrenals, kidneys, lymph. Those three are triplets. Always triplets. They follow. Matter of fact, let me say here, you get 2 or 3 kidney formulas, 1 lymphatic formula, and an adrenal formula initially. Everybody does. Because that's the doorway to all of this. Changing the diet is uno number 1. That's immediate effect upon the blood. Immediate. The problem is malabsorption. And a lot of people are gravely malabsorbed. So it just takes a little time to affect this. I would love to see IV herbs, but oh no. Hospitalized for 2 weeks, my INR has never stabilized between 2 to 3, so I finally asked if I could just get off of warfarin. No, but was then put on Eliquis. Although I have had no side effects, I live in fear of an aneurysm. No kidding. I know. And another thing is check your parathyroid. Check your parathyroid. Make sure you're utilizing calcium too. Look for other signs: varicose veins, spider veins, bruising easy, hernias, aneurysms, things like this. And that will be very helpful. A high electrolyte. All these things help to break up solidifications and masses, enhance nerve viscosity and things like this. I need to know if through your program one can get off of these types of blood thinners. I live in Texas but am willing to travel to be healthy. Peggy, you don't have to travel anywhere. That's why I do these videos. You don't have to spend the money. I'd rather see you guys learn on these videos. We do Skype appointments here. You don't have to travel here. Some child service, some people freak out because, oh, you mean you don't have to see them in person? Why would I have to see you in person? Health is simple. Life is simple. I don't need to look at every orifice of your body and do all that kind of stuff. That's stupid. We already know what the problem is. So, no. Get yourself on a protocol and go after this. 14-week protocol is adequate, although I would put you on circulation formulas immediately, upper and lower. Probably put you on the lung formula as well to help break up some of this congestion in these tissues that you might not even realize is there. Take a picture of your eyes and see what condition your lymphatic system is. But you want to be on a fruit diet, fruit, berries, and melon diet like now. I wouldn't even mess with vegetables. The vitamin K's and all that crap they talk about. No, I still wouldn't mess with vegetables. I would stay with the fruits and the berries and the melon, especially if I'm having blood clots.